It's been historically melded with what's called palliative care. So sort of the end-of-life care for patients, hospice. Supportive care is much more broad. It starts from dealing with the diagnosis of cancer all through treatment and even after treatment in terms of supporting all of the toxicities to enable or prevent the toxicities to enable patients to get the optimal amount of treatment that they can get so they have the most effective outcome relative to their tumor as possible. I think as much as we would like to believe it, the incidence of cancer is actually going to increase significantly in the next 25 years worldwide. What the good news is that survivability is also going to increase in the next 25 years, although that's largely dependent on where you live. Globally, in developed countries, the gap between survivability and mortality is getting better. Patients are surviving longer. On the supportive care side, what that means is no longer are we just dealing with acute toxicities happening in the moment, but those toxicities that continue through survivorship. In the less developed countries, there's less of a discrepancy between incidence and mortality. More patients die of their cancer in less developed countries than in developed countries. From the supportive care standpoint, if we can reduce toxicity, one can increase the aggressiveness of cancer. And so if a patient has to take less of a drug because they have toxicity and we can prevent that toxicity, they can get the full benefit from the drug. Some cancer treatments certainly are more effective for certain types of cancer. So for example, if you look at colorectal cancer, a very common form of cancer, and you look at the trajectory of survivability in the United States, in the UK, that's going up at a fantastic trajectory. It's going to be a survivable cancer.